Dr. Desai, Georgia Bone and Joint. Today is August 4th, and this is Mr. Horne. He's about 2 weeks out from his Jiffy Knee Replacement. When I saw him, I thought he was actually much further along, just given how quickly he was moving. But let me just start out and do less talking. Tell me what's been your experience so far.
My experience has been great. I just told my wife, I said, I would really have to give this a 10 out of 10.
Really?
I'm pleased to say that. My experience, I had the old school knee replacement that was non-robotically assisted about 10 years ago and just had a lot of trouble with it. It's just been night and day difference. So I kind of stumbled across Dr. Desai and this Jiffy Knee procedure and all that. And after watching the testimonials and all that, I said, and praying about it, I said, I think this is the way to go.
Mm-hmm.
And it absolutely has been. The swelling, the soreness, the achiness and all that, is to be expected. It's major surgery.
Mm-hmm.
But I experienced the same thing, but I only had a couple of nights of sleeplessness and, everything that just kind of routinely that you expect. But the mobility and all that immediately was much better.
Yeah.
And I literally, within just a few days, I was up walking.
Yeah, I mean, you said you pretty much dropped the assist devices, 3-4 days after surgery?
The day after surgery, I used the walker some. I immediately kind of felt stable enough and strong enough in the muscles in my leg. I used the cane, and I would use it if I walked outside or to walk back and forth. I keep that cane as kind of a safety device. But after about 3 or 4 days, I really feel like I didn't need it.
Yeah. I mean, 'cause you walked in here basically with nothing. And you said you've pretty much been doing therapy on your own. So he's from out of town, and so he's been doing exercises on his own, which is pretty amazing. Do you mind showing them, what your motion's like already? So he's already past 120. And then since you're up, maybe we can have you walk just a tiny bit. Okay, and then you can walk back. Perfect. All right, then have a seat for me real quick. You've got the Jiffy knee medial oblique incision, so straighten out the leg one more time. How far back? Can you bend it? Yeah, amazing, 120. So he's basically not taking any narcotics anymore. You said you stopped that around day 3 or 4?
Intermittently, a few times I had to take half of one or something like that, but for the most part, just Tylenol.
Yeah. And so, I mean, you could probably start driving soon if you haven't already. Yeah.
Thank you. You heard that, right?
So, I mean, again, I love doing these testimonials with folks like you, especially because you've had a traditional already, and so you can compare and contrast. So, I'm glad you're doing so well, and so
thank you. I am too.
Yeah,
very, very pleased.
Oh.
And the tightness and discomfort as far as pain, I'd say about a 1 right now.
Awesome.
It's just more tightness of when I get up, just kind of keeping it stretched out. That's going to get better. It's already getting better.
Pretty darn good. 14 days from surgery.
I think so too.
Awesome. All right, glad you're doing so well. Thanks for doing the testimony.